Hi, my name is Anton Maninang, and I'm a student nurse at the University of South Alabama, and today I will be demonstrating proper administration of medication today. Okay, this is my card. If the cameraman can do a 360 for me. All right, so first I will compare my patient care order form and my medication administration record. So take note of the name, Jaguar Jones, date of birth is 8/25/1963, 8/25/1963, medical record number 4176352, medical record number 4176352, allergies are penicillin, I would also like to note that before I would do all this, I would make sure that the medication room door is closed, would not be taking any phone calls, and I would limit any conversations with my colleague to anything that would be pertinent to me preparing for the medication. And I would also keep in mind the policy of zone of no distractions. Okay, so now I will check for the orders on both the order form and medication administration record. So heparin, 5,000 units, subcutaneous, every 12 hours. Okay, so now I'm going to put this aside. Perform hand hygiene. This through. All right, so I will now be performing my first check of the 7 rights. Jaguar Jones, date of birth 8/25/1963, and medical record number 4176352. Okay, so now I'll be assessing for the right medication, which is heparin. And as if you can see right here, it does say heparin, and it is at 10,000 units per milliliter. And also keep in mind the expiration date, which is 12/5/2025, which means this is still viable. And for the right dosage, it says 5,000 units. Now this vial does say 10,000 units per milliliter. So for that, we'll be using a tuberculin syringe. Keep in mind that this tuberculin syringe is designed for 1 milliliter. So in order to do the 5,000 units, we will have to use only half a milliliter to get the 5,000 units that we need to administer the dose. Okay, so I will be putting the air on the syringe up to half a milliliter. So if you can note right there, it is indeed half a milliliter. Okay, so next I'm going to check for the right route, which is subcutaneous. And to administer this medication subcutaneously, I would use this syringe. And right time, every 12 hours. And right indication, heparin is an anticoagulant, so I would use heparin to prevent blood clots. And right documentation. Just make sure that I'm able to give this medication legally. I have the official order for it. So now I'm going to demonstrate how to withdraw the medication from the vial. We'll wipe that out. Pull the cap. Inject. Deposit the air. Right to the sky. And then pull, ensuring that air bubbles are not accumulating. Okay. Right, just like for the camera to note that it is indeed half a milliliter, which would amount to 5,000 units of heparin. So, would put on the safety. Now we'll put this aside. So now I would do my second check of the 7 rights. Jaguar Jones, 8/25/1963 is the date of birth. Medical record number is 4176352. I would note the right medication, which is heparin. heparin. I would note that the right dosage is 5,000 units. This vial is 10,000 units per milliliter. So we're using this syringe at half a milliliter to get the 5,000 units that we need. Note the right route, which is subcutaneous, which I would be using a TB syringe for that. And for the right time, which is every 12 hours. So this is the first time I'd be administering this, so it'd be within that ordered time. Right indication, again, heparin is an anticoagulant, so I would be administering this medication to prevent blood clots. And right documentation, just make sure I have the legality to administer this medication. So next, I will prepare a label for the syringe. Oh, I would also like to note that I would have a colleague check after me to ensure that I'm administering the right medication and the right dosage, making sure that I did all my calculations correct. All right, so this label, I would put the name of the patient, Jones Jaguar, then the medication, which is heparin, and the dosage, which is 5,000 units. Just would like the camera to note my label. Okay. Okay, so I put this label on the syringe, making sure that it's not covering any of the numbers. It's a bit complicated. All right, get that. Outstanding. So now I would grab my syringe, my vial, my medical record number, a medical administration record. I would go to the patient's room. Hello, my name is Anton, I'm your student nurse, and today I'll be administering heparin for you today. And I would, first I would perform hand hygiene. I would check the armband compared to our medical administration record. Jones Jaguar, Jaguar Jones. Date of birth is 8/25/1963, 8/25/1963, and medical record number is 417-6352. 417-6352, and I would also note the allergies, which is penicillin, and I would also ask the patient if there was any other allergies that I need to be aware of before administering this medication. So now I will administer my third check of the 7 rights. As I stated before, right patient, Jaguar Jones, 8/25/1963, medical record number 417-6352. Right medication, you've got the heparin with this vial says 10,000 units, but we have the syringe at half a milliliter. Since it's 10,000 units per milliliter, this is half a millimeter, which would amount to 5,000 units. Right route, subcutaneously, which I would use a TB syringe for. Right time, every 12 hours. It is within that ordered time. Right indication, I would administer heparin to prevent blood clots, as it is an anticoagulant. And right documentation, which I have the medical administration record, which allows me to properly and legally administer this medication. So now I will raise the bed to a working height, lower the side rails, position the patient in a comfortable position to administer the medication, and now I will put on my gloves and goggles. Okay, so I would just like to state, before I would have put my gloves and goggles on, I would have assessed the patient for their vital signs their respiratory rate, their heart rate, their blood pressure, and would take note in any lab work that may interfere with this medication. Okay, so now I'm gonna discuss the administration site. So since this is being administered subcutaneously, I would administer it in the abdomen. I would in the umbilical area. I will not administer it to the top of the costal margin or below the pubic area, and I would keep in mind to remain within the border of the anterior superior iliac spine. And I would administer the medication in a U form around the umbilicus, maintaining a 2-inch border from the umbilicus or the belly button. So take note of the administration site. If there's any muscle, I would assess the muscle integrity and if there's any redness in the skin. Usually for subcutaneous, you have a choice between administering it at a 45-degree angle or a 90-degree angle, but depending on how much subcutaneous tissue you can pinch. So noting that you can pinch a good amount of subcutaneous tissue, I will be administering it at a 90-degree angle. So now I will cleanse the area with this alcohol pad. Inward the outward. Okay, I would grab my syringe, release the safety. Okay, now I will pinch the tissue, check fast, and administer it within a 30-second time period. Okay, release, apply pressure, but do not massage. And I would just dispose of that in my sharps container. Right, then, all right, I would assess the patient for any immediate signs of a side effect. All right, and then I would lower the bed, raise the side rail, put the patient in a comfortable position, dispose of my gloves, remove the goggles, return to the nursing station, document the patient's response to the medication, and then go back to the patient within 30 minutes or in the next 30 minutes to see how the medication has affected the patient. And that concludes my medication administration video.